I want to welcome all of you to the first ever AANEM Neuromuscular Virtual Fair. We are excited to have you all here with us. It is a wonderful opportunity for us to be able to help you listen to different programs and learn a little bit about them before you have to make a decision. So we hope you will just sit back, listen to the presenters, and then after that, we will have a question and answer, which will give you an opportunity to answer some questions. So thank you so much, and let's go ahead and get started.
Good evening and welcome to the Future Neuromuscular Specialist. My name is Margarita Molone. I'm the Program Director for the Neuromuscular Medicine Fellowship at Mayo Clinic in Rochester, Minnesota. These are pictures of our campus in Rochester. The neurology department and the neurology clinic are on the 8th floor of the Mayo building and the Gonda building. And then we have the inpatient service at St. Mary's Hospital, and we provide a consult at the Methodist Hospital. So we have 2 positions per year. Our fellowship is 2 years, and you will see the reason for this as I will explain the rotation. We are recruiting for 2022. Our neuromuscular medicine group includes 27 physicians, 5 nurses, our fellowship coordinator, and then our superstar, the current neuromuscular medicine fellows, who work close with the EMG, muscle, and peripheral nerve fellows. You see here my email address and the email address of Jean Smith, the coordinator. Please feel free to contact us. Most of our neuromuscular practice occurs in the outpatient setting, in the neuromuscular clinic and in the neuromuscular laboratories. In the clinics, we have a general neuromuscular clinic, a muscle clinic, and a peripheral nerve clinic, which occur on a daily basis. In these clinics, we see new patients or established patients requiring immunotherapy, and they are directed to the specific clinic on the basis of the underlying suspected pathology. Then we have the hereditary muscle disease clinic monthly. When a patient receives a diagnosis of a genetically muscle disease and elects to follow up in Rochester, or a diagnosis of a congenital myasthenia syndrome, we follow this patient in the hereditary muscle disease clinic. We have the ALS Clinic twice a week, where we see patients with established diagnosis of ALS. And we provide a consult at St. Mary's Hospital and Methodist Hospital. The EMG Lab is very active. We perform about 13,000 EMG studies a year. We see about 250 inpatients requiring EMG a year. We have 15 EMG rooms running simultaneously, one at the St. Mary's Hospital. In average, about 60 EMG studies a day are done, and we have 4 consultants covering the EMG lab on a daily basis. The muscle and the peripheral nerve lab are within neurology. The muscle lab interprets about 1,300, 1,400 muscle biopsies a year. We have 1 neuromuscular pathologist covering the muscle lab on a daily basis. We are 5 muscle pathologists. In the lab, there is a very deep integration with genetics, clinic, and serological findings. The nerve lab interprets about 350, 400 nerve biopsies annually. They also read the skin biopsies. There is 1 neuromuscular specialist in peripheral nerve disease reading nerve biopsies on a daily basis. And we have 4 nerve pathologists. The clinical rotation and laboratory rotation for the fellows include 3 main blocks: muscle neuromuscular clinic and muscle pathology lab, general neuromuscular clinic and the EMG lab, peripheral nerve clinic and peripheral nerve lab. Then there is elective time. These include 4 weeks, which are distributed along the 3 main rotations during the first year. The elective is 1 month per each block. this elective time can be eventually combined. The elective time can be spent in a clinical area or can be spent in basic labs. Everybody will have a half a day a week through the entire year for a research time, and there are 15 days a year of vacation. In terms of a formal education, we offer an introductory lecture to neuromuscular medicine at the beginning of the fellowship to the incoming fellows. We have the clinical neurophysiology course, which is given at the beginning of the first EMG rotation. On a monthly basis, we have an EMG conference, a muscle conference, and a nerve conference. Then interesting EMG cases are presented on a weekly basis. Interesting muscle disease cases are presented on a monthly basis. Clinical research is a strong component of the curriculum, considering the large spectrum of neuromuscular diseases. We see the large archives for EMG data, muscle and nerve biopsies. Clinical research is very easy at our center, and we encourage fellows to participate in it. You can present your research result at meetings. We encourage that. As fellow, you are allowed 10 presentation days per year. You can attend up to 5 meetings a year. We provide a budget for the meeting registration and other travel expenses. And you are also allowed to attend a meeting up to 1 year after completion of the fellowship to present your research data. There are also a few other perks that I'll be glad to list if anybody is interested. After completion of the neuromuscular fellowship, you'll be eligible for the neuromuscular medicine certification examination, the American Board of Electrodiagnostic Medicine examination through AANEM, and the clinical neuromuscular pathology certification examination through UCNS. During the 2 years of fellowship, you definitely will acquire a lot of experience in interpreting in an autonomous way muscle, nerve, skin biopsies. All our graduates have been certified so far, and all of them hold academic positions. In terms of social life, Rochester is a small city, about 116,000 people. Outdoor activity are possible during the summertime. Winter can be very cold. We have an international airport, so you can fly anywhere you wish for a warmer weather. And Minneapolis, which is a culturally very active city, is pretty close to Rochester. You can easily drive to it. So thank you so much for your attention. I look forward to reviewing your applications, and I hope I'm encouraging you to apply to our program. Thank you so much.
So hi, this is Dr. Manusakis. I'm an associate professor of neurology at the University of Minnesota in Minneapolis, and welcome to our neuromuscular medicine fellowship at the University of Minnesota. Certainly a very exciting time to do a neuromuscular medicine fellowship. In the last decade, we have seen very major advances in genetic sequencing, disease modeling, understanding mechanisms of neurodegeneration, roles of modifier genes, and modeling of potential therapies. And the future is here already. There are genetic interventions that are now FDA-approved drugs for diseases previously considered fatal or severely disabling, like spinal muscular atrophy, muscular dystrophies, hereditary amyloidosis, and hopefully very close to amyotrophic lateral sclerosis and CMT in the near future. So at the University of Minnesota, we have a group of 8 different board-certified neuromuscular physicians that offer education to the incoming fellows. We have 1 ACGME accredited position for a 1-year fellowship, and our fellows, upon completion, will be eligible for the ABPN Neuromuscular Medicine Board exam and AANEM electrodiagnostic exam. So our faculty, Dr. Allen, an associate professor of neurology, specializing in immune neuropathies and CIDP. We recently recruited Dr. Peter Kang. He will be the director of the muscular dystrophy Wellstone program on the clinic. He's a pediatric neuromuscular neurologist with a long experience coming from the University of Florida. Peter Karachunsky, associate professor, also pediatric neuromuscular, the program director. Dr. Walk, the chair of our division, specializing in Charcot-Marie-Tooth and ALS. And at Hennepin County Medical Center, we have Dr. Adam Lovenbrook with long training in autonomic neurology and a strong interest in the field, as well as small fiber neuropathy. Nathan Sitt, general neuromuscular neurologist, a graduate of our fellowship program. And at the VA Medical Center, we have Dr. Tiryaki, former program director of the neurology residency, with a long research record in ALS and a very strong interest in neurology education. Why choose the University of Minnesota for your fellowship? You have extensive clinical resources that you can benefit from. The Wellstone Muscular Dystrophy Center, which supports an adult and a pediatric MDA clinic. 3 ALS Association certified treatments of excellence in the same metro area. That's rather unusual and unique. So it's the University of Minnesota, HCMC, and Minneapolis VA. Remember, Center of Excellence means that it excels in clinical care, but also in research. Then we have a dedicated Charcot-Marie-Tooth Center of Excellence led by Dr. Walk at Maple Grove, one of the few such clinics in the United States, and the CIDP and Guillain-Barré Immune Neuropathy Center of Excellence at the U, led by Dr. Allen, and active also in several clinical trials. Also, our program offers extensive diagnostic resources and education on all the diagnostic methods used in neuromuscular medicine. We have EMG labs at all 3 sites, the University Medical Center, Hennepin County, and the VA. The volumes of EMGs we do at the university is about 1,400 studies a year, about the same at HCMC. We have a nerve and muscle ultrasound service in the last few years, incorporated in the EMG lab. We conduct skin biopsy every year for small fiber neuropathy. Now remember that the procedure was developed by Dr. William Kennedy at the University of Minnesota in the mid-1990s. Then we have an active nerve and muscle biopsy program, reading about 100 total muscle and nerve biopsies per year at the university, and a similar volume at Hennepin County Medical Center. Another unique feature within the training, within the umbrella of our program, we have 2 neuromuscular pathology accredited labs in town with personnel trained on each that can offer education to the fellow. And we also have a full service autonomic lab at Hennepin County Medical Center led by Dr. Loven. Okay, so see, this is some of the fancy things you can do at our training program. This is a nice picture of the skin biopsies from the Kennedy lab showing the normal skin of the calf and the marked denervation in small fiber neuropathy where you lose those green nerve fiber stains. We have neuromuscular ultrasound that I have become much more excited in the last few years and can be useful. The other day I had the case of a proximal median neuropathy of the Strathers ligament with a massively swollen nerve. There's no way you could see this with EMG. Then you can do the EMG studies in our lab, and you can do autonomic studies bottom right at Hennepin County Medical Center. Our technicians are doing the heart rate variability to deep breathing maneuver and recording it. So you can learn and will learn all those things during your 1 year of training. This is a sample fellow schedule during the year. It's pretty similar during the year. There is also 1 week, however, of physical medicine and rehabilitation rotation and 1 week of genetics rotation the year. The rest of the year is pretty similar. You can see what's in highlight is the multidisciplinary clinics. That's a very important feature of our program. Our MDA clinic, our CMT clinic at Maple Grove, and our ALS clinics are multidisciplinary. So the fellow interacts on a weekly basis with physical therapists, occupational, speech, nutritionist, pulmonologist, social worker, nurse. It is very important to realize this team mentality to provide the optimal care for neuromuscular patients. 3 half days a week is EMG, including autonomics in the 1 half. 1 half of the days for research, or elective, and also pediatric neuromuscular clinic with Drs. Karachunsky and Kang. More details on the didactics of the program, that's important. A couple of years ago, based on the fellows' feedback, we changed things a little bit, and we decided to provide a series of boot camp, quote unquote, lectures to the incoming fellows between July and September. Those are weekly lectures, about 5 in core neurophysiology topics and 8 to 9 lectures in core clinical topics. We felt this was imperative for the fellow to feel more comfortable in interpretation of cases and interpretation of EMG studies in the rest of the year. So following the completion of this bootcamp lectures offered by the staff, by the faculty, the fellow does a weekly EMG waveform conference discussing on average between 4 and 6 interesting cases every week from September of the year until completion of the fellowship on the 1st, 3rd, and 4th Friday for 2 hours. Then on the 2nd Friday of the month, we have a neuromuscular biopsy pathology conference, 8 to 10 a.m. We still also review the biopsies of the week each Friday at 10 to 11 a.m. On the 3rd Friday, we have the case of the month presentation that the fellow should put together, a PowerPoint. And we have a journal club on the 4th Friday, 9 to 10 a.m. And there is a neuromuscular ultrasound curriculum that I'm trying to develop as we speak. You also will have extensive research opportunities. The fellow is obliged to complete a small research project by the end of the year. It could be a retrospective study like case series. We have archived data too that can be useful for the fellow's project. This is encouraged very early on. Research opportunities include at the Muscular Dystrophy Center. We have treated the first patient with gene therapy for SMA in Minnesota. There's a strong history of funding of the Muscular Dystrophy Clinic, federal and MDA. We have a big Twin City ALS Research Consortium, including faculty from all 3 centers, which has been active for over a decade in a number of clinical trials in ALS. We have neuropathy research, both for hereditary, coordinated by Dr. Walk, and inflammatory neuropathies coordinated by Dr. Allen. The fellows have opportunity to help with all those projects during the year. And the productivity of the division in the past 3 years, we have had a total of over 50 funded projects if we take all the staff, and over 80 publications. And the key message is that fellows participating on this. So this is like a case report we wrote the other year with one of the graduating fellows, Sarah Hoosier, about a transthyretin amyloid myopathy, which was a particularly rare case. And this is an abstract we sent to AAN a few years ago with one of the recent fellows at lab in MRI with muscle biopsy finding correlation critical illness myopathy. Now, work-life balance is important when you choose a fellowship too, and very much emphasized in the last few years. So life in the Twin Cities is exciting. Minneapolis was ranked 13 among top 100 places to live in 2019, according to a website. There is a very strong job market, many Fortune 500 companies. It's the city of parks and lakes. Pretty much you have a park within 5 to 8-minute walk for every single resident of the metro area. That's what I've found. There's an emphasis on healthy lifestyle, a very culturally vibrant and diverse metro area with multiple ethnic communities, a great infrastructure, a large international airport, big Delta hub, you can go pretty much anywhere, excellent schools and hospital systems, certainly great for families. This is the Stone Arch Bridge downtown, this is the Minnehaha Falls, and this is the sculpture gallery garden, the Walker Out Museum, a few of the attraction for your off-work time. And the outcome of our recent graduates, it's mixed between private practice and academia. Samira is working in Iowa, Sarah is in Cleveland Clinic in Florida, and Ed, our most recent graduate, is now a fellow in San Diego in stroke, and he will return to Hennepin County Medical Center as neurohospitalist and neuromuscular specialist next summer. So with all this, I want to thank you for your attention. Please do not hesitate to contact Kathy Witzel, who is with us here, our fellowship coordinator, or myself. Here's our information. And do not hesitate to click to our website to find more info. Thank you very much. I'm happy to review your applications and take your questions.
Everybody, welcome. And thanks for coming. Just like everybody else had said before. Heather, can you go to the next slide? My name is Chris Nance. For those of you not familiar to Iowa, we're at the University of Iowa, and Iowa City is kind of in the southeastern region of Iowa. We're about 3.5 hours from Rochester to the north up here. and probably about 4.5 or 5 hours to Minneapolis. We're about 3 hours, 3.5 hours Chicago, 4 hours from St. Louis, 4 or 5 hours from Kansas City. So we're very, close to lots of different big cities. So a lot of people haven't been to Iowa, but that's where we are located. Next slide, Heather, please. And we are a university town. Here's a picture of the hospital, but there's lots of activities to do as well. But we're kind of a small college town. We're a Big Ten university town. So even though our numbers are not as big like Minneapolis or anything, there's always lots of stuff to do because we have a very vibrant college population. So there's always all types of festivals and sports and football games and going on throughout the year. Next slide. And here's our main neuromuscular faculty. There's me there, third on the right there. But starting over on the left, there's Dr. Matthews. She does our pediatric neuromuscular program. She's one of the world's experts in dystrophic glycanopathies. Next to her is Dr. Gutman, who's been doing neuromuscular diseases for about 50 years. So he is a wealth of information, not only in neuromuscular diseases, but EMG as well. There's me. Next to me is Dr. Shai, who's one of the world's experts, if not the world expert in Charcot-Marie tooth disease. And then at the bottom there is Dr. Swenson, who runs our ALS and MDA clinics. Next slide, please, Heather. So here's just kind of a generic schedule that we closely follow. It is flexible later on in the year, and we can suit it to according to the fellow's interests. But the first month is EMG Lab. You start just learning the basics and advance with nerve conduction studies and the needle exam, the EMG. And then the second month on, pretty much you're on the same schedule. Monday morning, you have your fellow clinic, and then EMG in the afternoon. Tuesday, you're all day with Dr. Matthews in the pediatric neuromuscular clinic, where you see genetic diseases from infants to she still follows adults. So this is where you see all the rare types of limb-girdle muscular dystrophies and other inherited myopathies. Wednesday is when we have our weekly ALS MDA clinic. So fellows can do that every week, or they can also do more general clinic and EMG, or split it up, however the day seems fit. Thursday is CMT clinic, where Dr. Shai's patients come from all over the country and all over the world to try to get their rare and interesting genetic and hereditary diseases diagnosed. Friday morning is usually EMG with research in the afternoon, but on third Friday of every month, we have a myotonic dystrophy multidisciplinary clinic as well. So we have an ALS MDA multidisciplinary clinic, a CMT multidisciplinary clinic, and a myotonic dystrophy multidisciplinary clinic that runs regularly. Next slide, Heather. We also have a couple of outreach clinics that the fellows can choose to go to. We also have an ALS outreach clinic in Des Moines the first Monday of each month, and there's pediatric outreach neuromuscular clinics about twice a month at various locations throughout the state. Next slide, Heather. As far as our educational schedule, and this is pictures of several of our other neuropathologists, Dr. Kimura, who wrote the textbook on EMG. Dr. Campbell is very much into basic science of myopathies. The first Friday of every month, we have Neuromuscular Journal Club, where the staff presents, or basic science researchers present, or the fellow presents. You can pretty much present on anything that you want to, as long as you have has to do with neuromuscular disease. The second through the fourth Fridays of the month are my favorite time of the week because we review outside nerve and muscle biopsies from in-house and all over the country. Dr. Moore here, second from the right, is one of the world's experts in genetic neuromuscular diseases. So his pathology conferences are outstanding. Every other Friday we have Neuromuscular Clinic conference. That's for the fellows and the residents and the medical students. We have a monthly Wellstone. We also are Wellstone Center 2, where we have the neuromuscular staff and the basic science faculty from the university talk about genetic diseases and research into new diagnosis of genetic diseases. Today we were talking about a rare variant from a girl in Sioux Falls, Iowa, who was like the third case in the world, and how they asked the basic scientists from the other side of the university, and they did research on Drosophila flies. So that was very interesting. And then Tuesday, we have department grand rounds, which can cover the broad spectrum of neurology. Next slide, Heather. Our EMG lab, we usually do about 5 to 7 EMGs per half day, or 10 or 14. You can do the numbers and multiply that, how many we have in a year. We have at least 6 staff who do EMGs and 2 or 3 techs. Next slide, Heather. We also have 4 genetic counselors, as mentioned previously by the other presenters. The genetics of neuromuscular disease is huge and expanding. So we have 4 genetic counselors working in our section themselves. They're a huge help in trying to diagnose these rare neuromuscular diseases. And next. And we have research studies going on in a variety of things, CMT, ALS, myotonic dystrophy, myasthenia, peripheral nerve, Pompe's disease. So we have research studies going on across the spectrum. So next slide, Heather. And our previous fellows, they're split, about 3 are in academics, 3 are in private practice, and our one last year is still continuing in his education in pediatric neuromuscular disorders. Next. So if you have any questions, contact me. There's my email up there, or Ms. Clement, who's our fellowship coordinator, and we'd be more than happy to talk to you, more than happy to ask any questions. We are recruiting, for the year starting 2022, but we have an opening for 2021. So if anybody's interested in that year, please let me know as well. Thank you very much.
I'm Dr. Shroff. I'm the program director for Houston Methodist Neuromuscular Fellowship Program. Welcome to all the residents who are interested in Neuromuscular Fellowship. I have Dr. Anderson, who is our previous fellow who has recently joined us as a faculty, and I thought who best, to present our program. So without any delay, I'm going to let Dr. Anderson take over the talk. Yeah.
Good evening, everyone. Can everyone hear me and see the screen? All right, good. So as Dr. Shroff mentioned, my name is Ashley Anderson. I am one of the most recent fellowship graduates from the neuromuscular program, and decided to join the faculty. And I've been on the neuromuscular and part of the general neurology faculty as well here at Houston Methodist since August of last year. So very, very glad that I can join you all tonight and talk about our fellowship program. So I'll quickly go ahead and get started so we can get to questions. So just a little history about Houston Methodist and our Neurological Institute. So it was founded in 2005. And it consists of our neurology department, neurosurgery, we have neuroradiology, neuro-ophthalmology, as well as neuropathology. And just as a overall Houston Methodist, just over 50 years of just in neurology of history and tradition of resident and faculty investigator training. And I think Houston Methodist in of itself celebrated over 100 years as part of an institution. And our mission here is just to translate advances into neuroscience into meaningful and clinical therapies that fostered by active collaborations between the fields. And so we do that with education and training of our residents and fellows so that they can be leaders in both clinical neurology as well as in the neurosciences. So our initial ACGME accreditation was received in 2007, and then we had full accreditation in 2009. And fellowships approved in 2010 for the neuromuscular medicine, and the fellowship started in July 2011. So far we've had 8 fellows that have successfully completed the program and have passed the neuromuscular medicine board examination after their training. And so our neuromuscular fellowship program offers 1 to 2 positions per year. And we see over 75 neuromuscular patients every week. And so those patients can include those with ALS or other type of motor neuron disease, myasthenia, myopathies, and various types of neuropathies. And of course, now in this kind of, I would say post-COVID, but maybe peri-COVID or current COVID era, we are seeing a lot of patients with neuropathic issues with post-COVID diagnosis. We do about 100 muscle, nerve, and or skin biopsies per year, and Dr. Schroff is the one who handles all of our muscle biopsies. And we do in excess of 2,000 EMG cases per year. And then in order to prepare our fellows for the neuromuscular boards, there is an in-service examination during the fellowship. And as part of the requirements for the fellowship, you have to be American Board of Psychiatry and Neurology certified, have current medical license, and of course, successful completion of a neurology or physical medicine and rehabilitation program. So first up, in talking about our faculty, we would be remiss if we didn't first mention our esteemed chair, Dr. Stanley Appel, who is, I'm sure, known by all of you, and who is just one of the leaders in neuromuscular and of course ALS. And one of the great things I remember about my fellowship is getting the opportunity to work closely with him, especially as we rounded on patients that were coming in for a possible diagnosis of ALS or motor neuron disease, and to have just that opportunity to get to learn from him so closely. And then Dr. Sheetal Schroff, who introduced herself at the beginning of this talk, is our Neuromuscular Fellowship Program Director and Assistant Professor, and who, again, performs a lot of our muscle biopsies. She also does neuromuscular ultrasound for us, and is involved in our neuromuscular medicine and electrodiagnostic medicine team. And then going on to some of our other neuromuscular faculty, we have Dr. Erica Simpson Green, who is who is the chair of our division in the neuromuscular division. And then we have Dr. Glenn Smith, who has been part of our program for a long time, and it was actually Dr. Appel's resident and fellow years ago. And then Dr. Thornhoff, who was also a fellow here at Houston Methodist and decided to join on as faculty. And then Dr. Bing Liao is another assistant professor here of clinical neurology, as well as neuromuscular and electrodiagnostic medicine. And then myself, the newest member here of the neuromuscular team. And then Dr. Rosenfield is the director of our EMG and motor control lab. He's a professor of neurology, and he's also a chair in our speech and language division in neurology. As part of our training, we get to work with our pediatric neuromuscular faculty over at the University of Texas. And so the team that we work with is Dr. Pedro Mancias and he does pediatric EMG and a lot of congenital neuropathies and neuromuscular disorders, as well as acquired neuropathies. And then we have Dr. Sade Moody, who works with congenital and acquired neuromuscular disorders, as well as anomalies of the brain and the spinal cord. And so a sample rotation is given here on this slide, and this can be adjusted based on, you know, the fellow's interests, as well as, you know, who's kind of rotating on and off. But you see a lot of outpatient exposure, a lot of exposure to a lot of our clinics. And then here, ALS and neuromuscular, again, talking about when rotating with Dr. Appel, as far as evaluating some of those new patients with diagnosis, as well as seeing our inpatient neuromuscular patients. And then we have electives that can be in procedures, additional EMG, working with physical medicine and rehabilitation. So that's something that can be discussed with the fellow based on their, and determined based on their interests. And again, here just going into some of the electives that we have, again, additional EMG and ultrasound, muscle and nerve pathology, research, physical medicine, there's pain, and then our neuromuscular pulmonology folks that we often work with for a lot of our neuromuscular patients, to where, of course, we know they have respiratory issues, to learn more about that, and then get even more pediatric exposure. And that could also include working through the Shriners Hospital here and seeing some very interesting pediatric EMGs that are done in neuromuscular cases. And so we are able to present and to be present at meetings throughout the year. They'll cover the expenses for one meeting every year. Of course, if we present research that we have done, either case report or all kind of ongoing research, funding can be provided for that as well. And so there's a list here of some of our prior fellows, and some of these are names that have already been mentioned because you've seen them as ongoing here in the Houston Methodist faculty, such as myself and Dr. Thonhoff back in 2016, and then Dr. Schroff as well was a fellow here. And you can see where some have gone on to mostly academic practices throughout the country. And so research is an important part of what we do here. And so there is a required research project, and there is required, allocated time for research to be done, and as part of that, part of your schedule. And this can be clinical, translational, or basic science research. And fellows are encouraged to develop their own project, but they can also join an ongoing project as well. And then we have several specialty clinics. And so for our muscular dystrophy clinic, this occurs twice per month, and we see a variety of different muscular dystrophies, as well as patients with myasthenia gravis. And the fellows kind of serve as kind of acting attendings there, and the residents also participate in that. So it's a good opportunity to see some interesting cases and to do some actual hands-on teaching. We have a similar clinic, which is our myotonic dystrophy clinic, which occurs quarterly. We see many patients there, and again, this is a comprehensive clinic where they'll see a neurologist as well as other supportive staff if they need cardiology, respiratory therapy, physical therapy, occupational therapy. We can also get them in for pulmonology as well. It may not be the same day, but we can definitely get them in to see those folks if they need to. And again, fellows are assigned to see these patients as well. And so it allows for us to get more hands-on training along with the residents. Again, some more teaching there, of course. And then we have, again, here is our MDA, but mostly our ALS patients in our monthly clinic that occurs at the first of the month, on a Friday. We have here to where the fellows rotate through not only seeing the patients, but also following along with our kind of ancillary staff, physical and occupational therapy, to see what they do and how they work with the ALS patients. And this, again, is a comprehensive clinic where these patients kind of a one-stop shop where they come in and see everybody on day. And pre-COVID, it was a great social activity as well, and for our ALS patients to kind of get to connect and make some connections with people from all over. And then we also do some training and some lectures as well that are fellow specific, looking at electrodiagnostic medicine. That's several times a month. Then there are faculty-led, neuromuscular case conferences and journal clubs, and then fellow-led neuromuscular case conferences as well. And then there is a quarterly advances in neuromuscular disease that is done by our neuromuscular faculty. And the fellows are given an opportunity to present as well and to teach during resident lectures. And so our clinical neuromuscular fellowship is 1 year, and then you can do an additional year in clinical, translational, or basic science research. Then where an IRB project is encouraged in publications, as well as having some ongoing clinical responsibilities. And then that is, you have a mentor there with the program director, and again, clinical and basic science research. And then you can do some clinical epidemiology and biostatistics, as well as learning about trial design and methods in order to help. And this is done in conjunction with not only our own research institute, but as well as with the University of Texas and Houston School of Public Medicine. And then I'll just finish up here, just talking about the great city of Houston. So we're a large city that offers a lot. And so NASA, of course, is based here. We have a lot of different outdoor activities that I'm hoping that we can get back to soon. Great restaurants, great art and history here. And of course, some wonderful sports teams that I'm hoping will get better in the upcoming year. All right, thank you guys so much for your attention. I'm happy to take any questions.
All right, thank you, Dr. Anderson. All right, well, we will go ahead and jump into the question and answer. If anybody has any questions out there, please put those into the chat. While we're waiting for some questions to come through, I'm going to just ask here a question. Sherlyn Atkins, the Executive Director, has actually been asking those of you, what drew you to neuromuscular medicine? Why did you pick neuromuscular medicine as opposed to some other specialty? Anybody want to chime in?
How long do we have?
Well, there's no questions yet.
All right, well, I'll go briefly since I finished up last. I'll say, and probably one of the newer ones on here, choosing neuromuscular. So it was interesting to see that Dr. Peter Kang is going to be joining Minnesota. I actually went to University of Florida in Gainesville for my neurology residency. And so I got to work with Dr. Kang. But I chose neuromuscular for a variety of reasons. One, because the patient population is so broad. In a day, I can see patients that are 20 years old. And I think the oldest I've seen in a day, that same day, was 96 years old. And I don't know many subspecialties that can do that. There's also opportunities for hands-on procedures like EMG, muscle biopsy, skin biopsy. And so it is just so varied. And within neuromuscular, the types of things that you can do is whether it's neuropathies, myopathies, motor neuron disease, neuromuscular junction is just so fascinating. And it's such an ever-growing field, as was mentioned several times before.
I would say that if there were like a couple of things that attracted me, I mean, the one is, that in neuromuscular medicine, everything comes so natural. It's like, we teach traditionally that you have to take the history, you have to do a careful exam, you have to narrow down your differential diagnosis, and then use the test to confirm. Well, that's exactly how neuromuscular does things. You have to do a careful exam, you have to figure out where the problem is, and then you start thinking, you narrow things down. And the EMG is a continuation of a neuromuscular exam. You test the muscles you think are going to be most likely affected, really. That's the nice thing about it. And, we tend to forget this a little bit in some other neurology disciplines, whereas in neuromuscular, we still have to stick by this, and that can be pretty fascinating. Well, the most important, however, is, again, that when I decided for neuromuscular about 12 years ago or 13 years ago, at that time, there were so many devastating diseases with a huge impact on people's lives and families' lives, that at that time, I was hoping that we would see some progress, that we would understand the genetic and molecular mechanism, we would have some treatments. But honestly, I didn't expect that by 2015 or 16, we would have antisense treatments for spinal muscular atrophy or genetic therapies for amyloidosis or muscular dystrophy. It was impressive. Things even progressed faster than I expected. And here we are in 2020, and we can give treatment to things we're considering incurable, fatal, forget about it, okay? So we're not just palliative only. We can change the course of terrible diseases. That's, what's so gratifying in a sense, so.
Yeah, I would just echo that too. I mean, I graduated medical school in 1999, and basically everything you learn there, you can just throw out the books because of the genetic explosion. And neuromuscular disease, I mean, we're on the cutting edge of being able to treat a lot of these, used to be devastating diseases, and we're on the cusp of, the next 10, 20, 30 years to hopefully be able to cure, ALS and a lot of these muscular dystrophies as well. So it's a very exciting time to go into neuromuscular disease.
Yeah, neuromuscular medicine requires a lot of thinking and a lot of logic. It's like making a puzzle. And as I said before by my colleagues, clinical history and examination are still a crucial part of your diagnostic workup, despite the advancement of the genetic techniques and everything else. Plus, there is that very interesting warm contact with patients who may have not yet treatable disease. They create a particular bond with the patient. And then along the years, because I'm old, I have seen patients I was unable to treat for whom now there is treatment. And that is very rewarding. And this is definitely a great time to step into the neuromuscular medicine world.
I completely agree with all my colleagues said over here. I mean, the first thing for me was from the time you see the patient in the clinic, and then all the diagnostic tests you do, and then whether it is EMG or biopsies or whatever, and you can definitely read them too, interpret them too, and then come to the diagnosis and then offer them the treatment, and then of course follow them and see how they respond to treatment. So it's the whole spectrum of the disease, the diagnosis, the treatment, and how they respond to it. And it's just beautiful to follow patients like that and see how they improve with time. Yes, there are some diseases, yes, no cure, but some definitely, there is something we can say, especially for amyloid neuropathy, maybe 10 years ago, there was nothing, yes, you have amyloid neuropathy and then that's it. And now at least we can offer treatment, and same thing with other genetic conditions like SMA. So it's very exciting, and the field, neuromuscular medicine field, is definitely expanding, and that's exciting to me. Yeah.
Thank you for sharing. That it really is truly the best time to be part of neuromuscular medicine. So we appreciate hearing from you guys on what drew you to it. It looks like Dr. Malone, we do have one question out there. Wants to know if there's any opportunity for a fellow to be trained on how to do neuromuscular ultrasound.
Yes, thank you, Dr. Wanarang, for raising this question. Ultrasound is part of the EMG Lab, is embedded in the EMG training. At the moment, ultrasound is done routinely, for example, for the diaphragm, for studying phrenic neuropathy and muscle disease affecting diaphragm, or any other neuromuscular disorder affecting diaphragm and phrenic nerve, is done for assessment of carpal tunnel syndrome. And the EMG Lab is actually developing at the moment an ultrasound more formal training course for our fellow. We have people like Dr. Boone, who is a physiatrist and works also in the EMG Lab, who has a huge amount of experience with ultrasound.
Okay, well, we'll go ahead and wrap this up. We won't keep you guys any longer. Thank you so much for joining us, and thank you, program directors, for giving your presentations. We sure appreciate the time that you put into this. We know you have busy schedules, so it's fantastic that you're willing to do this. Let's hope this is one of many more virtual fellowship fairs to come. So thank you so much, and have a wonderful evening.